Dabbuchikitis. I had a left temporal craniotomy for a split dura and fractionalization in my skull. You know, if it wasn't for Dr. Kenning and for Dr. Sukul, I wouldn't be here today to tell my story. It was a surprise because this type of condition normally happens to people who've been in an accident or have had some kind of trauma. I had none. I had none at all. My presentation and my symptoms were very gradual in my ear. Tremendous ear pain, internal ear pain, and from that I would get a spray of pain up into my head that would last a split second. And you know, by looking in my ear, they just couldn't see anything. And I could tell I was losing my ability to, you know, to communicate.
She couldn't always finish sentences, couldn't recognize words. Sometimes would use inappropriate words. Some of that I sort of thought, okay, maybe she's getting older. It could be any number of things. The other thing I noticed was a real change in her personality and behavior, because she's ordinarily very gregarious and chatty and communicative and everything. We went to St. Peter's Hospital emergency room initially.
St. Peter's put me into a CAT scan, came out, put me into an ambulance. You're going to Albany Med.
Basically, Deb had basically a small hole, or a small series of holes in the base of the skull, which essentially had let air and fluid in such a way that it became trapped and was pressing up against the temporal lobe of her brain, which is an area that is very sensitive and can affect language and things along those lines.
And so essentially what we did was a procedure to block off that communication between the ear cavity and the intracranial cavity. So the procedure gets done in the operating room under general anesthesia. We make a small incision around the right ear, and essentially a window opening in the bone, and dissect underneath the brain to find that defect. And there's a defect not only in the bone, but also in the case around the brain, and a small portion of the brain, the temporal lobe, which is pushed down through that opening into the middle ear itself. So it results in a lot of inflammation and potential for infection and meningitis and spinal fluid leak. So essentially remove all that inflammatory material and then do a multi-layered repair.
When I was in the post-op room, I came right back to myself. It was like somebody flipped the switch. At Albany Med, my care was extraordinary all the way around. As they opened the doors, and I was in an OR that I never anticipated, all of a sudden it all came drowning down inside. And I was like, oh boy. But it was Anna. She's the nurse. Very calm, very kind, very respectful. Talking to me like, you know, I am here and you don't need to be concerned. It takes 5 seconds to change somebody's life for the better, believe it or not. It really took on a very sort of personalized, emotional kind of moment for me with her. They also took very good care of my husband.
I'd leave Debbie every evening at 7 or 8 o'clock, and I always felt very comfortable that she was in good hands and that they would take good care of her.
It's been an interesting time for us because we're both home now and we're both retired. Yeah, and we have a wedding. We have a big wedding coming up. Our son's getting married. You know, now we're retired and we have a home with 2 dogs. And so some of the conversation is, what are we doing next? Where are we going? And I said to Gary, I'm not leaving Dr. Kenning, and I'm not leaving Dr. Sukul, and I'm certainly not going to leave Albany Med.